Hi, good morning all. My name is Kiran Manoj. I'm an OT online trainer. Today we are gonna start classes for OET exactly. That is, there are four modules. In four modules, we are gonna start with listening section, listening, reading, speaking, and writing. In that, we are gonna start with listening. It's the first module in the OET writing exam, and it is interesting one. You need to hear the audios and you need to find the answers. You need to find the answers. It's simple. You can listen and improve the listening skill. That's one of the best thing you can do in the listening test to crack your exams. First of all, we are gonna start with the listening test, the criterias and the way you are gonna attend. Okay. First of all, listening test has will be 50 minutes. That's a time. Listening test 50 minutes. 50 minutes. Okay. In 50 minutes, you are gonna hear something and you need to find the answers. There are 42 questions. You are gonna attend 42 questions in 40 minutes. That means 5 minutes you will have time for writing the answer, copying it in the paper. That's it. That's all about it. Okay. In listening test, you have three parts. This is a part A, part B, and part C. Part A, you will start with the consultation extracts. For 5 minutes, you will hear each. Part A has two subsections. Part A, it will be divided into two subsections. One, you will hear a consultation extract. That means a patient will be attending a doctor, a patient will be attending a physiotherapist, patient will be attending a someone. So the conversation between them, you need to hear that and find the words from that. If patient is saying, I had pain in the chest, I had pain in the knees, so you need to find the because a nurse need to know, a nurse or doctor need to listen what the patient is complaining about. That's what the skill is tested in this part A sessions, because you need to find the words exactly what the patient is saying. If patient is saying their name Tracia, you need to write the answer Tracia, because you have the good, if you have a good listening skill, you will find the answer Tracia exactly and you will write copy the paper answer. That's the thing you are tested in part A. That is two sub-sessions, same. One will be different conversation and the other will be different conversation. Okay, please note this point. Note that health professionals may be any one of the 12 professionals who can take OET. Okay, and this is the part A session, and then you will go for part B. Part B, you will go for a short workplace extracts about 1 minute each. Okay, you will go for short extracts. Okay, in short extracts you will attend only 6 questions. That means from 25, 26, 27, 28, 29, 30. That means 6 extracts you will hear. Each extract you need to attend a answer. That means a question will be there, a extract will be, you will hear extract and you will answer the question. That means multiple choice questions. Okay, team briefings. Examples are team briefings, handover, health professional dialogues. Okay, team briefings, a team briefing with the team, that these are the case about the patient, and handover. We are going to give a handover to someone that this is a condition, this is a thing. They will conversation, the conversation between two health professionals, and the health professional dialogues, some kind of dialogues. These are the things extract we'll go through the part B. A extract, a question, and you need to find the answer from the 3 multiple choice questions. That's it. So a extract you will hear and answers, find out the answers. In part C, you will hear different 2 extracts like part A itself, but the thing is, it is not a conversation, it will be a presentation. Okay, presentation, the extracts about 5 minutes each. Okay, part C, you will hear presentations, big one. Somebody will teach something, you need to take notes from that. not notes. You will need to find out answers from that. That is notes, in the sense you need to find out answers from the choice, multiple choice, A, B, C. So you need to find the answers exactly what they are meaning from the audio. So you need to listen the audio carefully and find the answers from the multiple choice questions, because what they are teaching, if you are not understanding, what is the use of listening skill, that they are tested in the part C, part A and part B. So this is all about listening is a skill, you need to develop it, and this they are gonna testing. Okay, that's it. So this is all about it, and we are gonna start with exactly what is listening subtest. The scores will be like, it is not written here, but I can give some other examples for you. Like, this is a listening test. Okay, this is the question paper. This is a model. Okay, you need to have a look on through this. You can read this in this part of the test. Here, two different extracts. This is the extract which I mentioned to you. Part A. A health professional is talking to his patient for question 1 to 24. Complete the notes with the information you hear. You will hear a extract from 1 to 12. Till that, a extract will be heard. Okay, heard, and in that extract they will talk about, hi, good morning, my name is so and so. Can I know your name, please? Okay, my name is Dishabal. I'm 45 years old. I have swelling developed on the left testicles. Can you please help me? So please give me a detailed picture regarding your condition. Patient, we'll talk to the patient. So patient gives a description of the condition. I had a marginal B cell lymphoma and cured with dash 2 years ago. Dash 2 years ago. With medications or surgery, whatever it might be. So developed a diffuse large B cell lymphoma last year and was treated with CHOP reduction. The disease was again reformed. Maybe the answer may be reformed or something like that. The disease was again. What happened to that? The disease was again. So we need to listen to the audio what they are talking about. Swelling developed on the left testicle last week. I had fevers and chills on the for the past. We are not gonna hear and exactly, but we need to listen to these points, because only then you can hear what they are going to talk about. When they are going to talk about the family history of illness, you need to listen carefully and find out the answer. Mother had paralysis before the death of 70. Father is deceased at the age of 84 of a condition. Why the father has died? Because of some condition, the father has died, and the answer of that is third answer. You can point out here. Yeah, this is the answer. Father deceased at the age of 84 of a dash. What happened to him? That is answer. Okay, such a way you need to find the answers in the part A. The same thing will be repeated in the part B, but the same, because the patient will be having a conversation with the medical professional. In that medical conversation, you need to find the answers. Patient's problem, you can hear patient's problem, family history. Patient will be saying family history, his diagnosis. Okay, physical examination. In physical examination they will talk something like no congenital icterus, no adenopathy, no carotid brutus, lungs are clear, no gallop or murmur in heart, your right testicle is dash what, endocrine shows dash what, less testicular swelling, it is tender, etiology possibly epididymitis or what is that, ultrasound test for what, that all will be here in the audio. Okay, this is the part A. Okay, in part B I am not going to make a congestion all about it, but the thing is I'll give some brief thing and I'll give a detailed picture in the next classes. Okay, in part B you hear a extract, you hear a extract like this. You hear a discussion between a doctor and nurse about hypoxia and its causes. Which of the following condition arises due to decreased blood flow to the tissues? Hypoxic hypoxia or histotoxic hypoxia or stagnant hypoxia? You need to hear the extract and you need to find the answer from this. Which of the following conditions arises due to decreased blood flow to the tissues? Okay, that extract will be played by the discussion is between a doctor and a nurse about hypoxia. In hypoxia, you need to find out which following condition arises due to decreased blood flow to the tissues, because they will talk about all hypoxic hypoxia, histotoxic hypoxia, stagnant hypoxia, but you need to listen carefully and find the answer what they have talked about condition arises due to decreased blood flow to the tissues. Okay, the same thing in 26, 27, 28 we need to hear one extract. I will give you a detailed picture in the next classes, but I am giving a small picture. But in the session of 31 to part C, you can go have a look at part C. In part C it is different. We will hear an extract carefully, like they will talk about, you will hear in the part of the test you will hear two different extracts. In each extract you will hear health professional talk about specific aspect of his work. There are someone is talking about stroke or embolism, like all head related problems. So they will talk about all these things like brain, many of the brain conditions, stroke, everything they will talk about. A specific topic they will talk about. You need to find the answers, like from here 31, this all things you need to find out, like this all things. This all will come under a extract. So you can't listen to a single extract, you need to listen to an extract and you need to find out all things. You need to find each by one by one by one by one. Like I will show you some example, you can go through this. The stroke is caused by embolism is which kind of stroke caused by embolism? That is exactly watershed stroke, ischemic stroke or hemorrhagic stroke. We need to find out from the audio. Okay, they will explain it detailed way and we need to find out which stroke is caused by embolism. Okay, second one, brain aneurysm is caused in, and we need to listen from the audio. They will talk about something like ischemic stroke, watershed stroke or hemorrhagic stroke. Brain aneurysm is caused in which stroke? We need to find out that. So this is all about listening session, so I am not making it bore. Please listen to this, and if you have some doubts, please comment on that. We'll clarify in the next classes, and this is one of the interesting classes we are gonna take in next few feature, because in the listening section we are going to give much more introduction and information in the next classes. Please stick on to the channel Tatvamasi Learning Hub. Thank you all. Thank you for your patient listening, and you will get interested in next class. Bye. Thank you.